All right. And then before I introduced our amazing guest speaker today, for people that just logged in or confused as to why everyone's inundating the chat with information, if you're requesting CEUs for this presentation, in the chat, I just need you to put your name, your license number, and your discipline. So psychologist, social worker, whatever it might be. And then we'll be able to get you those CE credits shortly after. So make sure you get that all sorted out. I'm going to check our email, make sure no one's having trouble logging in. Okay, sweet. So I'm going to go ahead and introduce Tien here, and then we will get things going, okay? All right. So, oh, one other person logging in. Okay. So Tien Kuei, did I get that right, Tien?
Yes.
Yeah. Okay. Tien Kuei, she's the founder and CEO of the Power to Live Foundation, a mental health charity in the UK with a mission to expand training in behavioral treatments to offer quality therapy for low-income groups. Tien is a community member of the ACBS for the past 16 years, being a specialist in ACT and a certified FAP trainer with the University of Washington. She regularly runs FAP workshops, and she is an invited presenter at many different conferences. Over the years, Tien has received mentoring and supervision from Mavis Tsai and is a board member of the FAP Ethics Committee, organizing the FAP Intensive in Europe, and she honors and she values lifelong learning. And Tien will talk a little bit more about the intensive that she offers, which is really, really cool stuff. And Mavis Tsai, Tien, Mavis is like the one of the FAP sort of gods, if I could say, like in the okay. So yeah, you're kind of getting this stuff straight from the source, which is pretty cool.
Yes, absolutely. So the intensive that we used to go back in the day was really true to its word, intensive. She would pretty much break us down and build us back up. Yeah, and you find on day three, everybody's in tears and kind of collapsing all over the place. And I think that structure has changed a lot because I think different generations have different needs. And now the intensive is a lot more regulated. And I think FAP, so Mavis has stepped away from that intensive format. And actually, she hasn't run any for a very long time. This is why I revived it in Europe last year, because I think it's still a really valuable space. But I would say maybe the next generation, with the next generation, we're kind of taking it over and we're sort of growing FAP and evolving it forward. It's like anything in third wave or even fourth wave, science does not stand still. So it's really exciting that, things are evolving.
Well, I'm so excited for this. Tian, thank you so much for kind of preaching to us about FAP and the new ways. And then one last time before we get going, for people that just logged in the chat, if you want CEs, put your name, discipline, and license number, and we'll get you those CEs. And otherwise, Tien, the floor
Okay.
is yours.
Thank you, everybody. And I can see all of you are very seasoned and mature as clinician. So it makes it really easy for me to do this. And I know in the States you have a lot better behavioral training than we do in the UK. So in a way, I came into behaviorism via Mavis, via FAP, via ACBS, and had a crash course on this and very steep learning curve. So in a way, FAP is straightforward. It's functional analysis, and if you have that background, I don't need to give you that background. But then what is FAP? Why learn it? Some of you might know about it, some of you don't. And of course, the acronym is not the American slang for other things. Um, so the question is, have you encountered any difficulties, frustrations, limitations with the therapeutic modality that you practice and in the way it impacts your clients? So I'm kind of curious to start with that question because then it gives us a context of why it's important and it's interesting to learn FAP. So if you don't mind, maybe just sharing your thoughts on that. Difficulties, frustrations, and limitations. And maybe you just had clients this week that you had a moment with. So Max will keep an eye on the chat, and I will let you type and then maybe move on, and then we'll come back to this.
Tien, would you like me to just kind of read out the answers in the chat, or would you rather people sort of like I can kind of like call them out, unmute them, and they could speak to their experience personally? What do you prefer?
I think shout them out if you don't mind, Max. Then we can make sense of it.
Okay.
Getting by, yeah, okay. So mindfulness, I can see some here coming through. There's
Mhm.
always a slight delay with chat.
Yeah,
Okay,
Mitchell says getting by, on mindfulness skills or experiential exercises. It's an important one.
yeah. And some of you are ACT practitioners, and you know that mindfulness is a really important element in ACT, and it certainly has serves a very important attentional process. So what is FAP? Why learn it? And you'll find that as you send your questions and your difficulties through, FAP hopefully will address some of these. So first of all, FAP helps you build a detailed behavioral model of the client through functional analysis. And functional analysis, as we all know, is the foundation to this process approach. And I would say, FAP has been doing process for a long time. Now Stephen Hayes is designing his own process-based therapy. But I would say FAP has an easier version of that and much more clinician friendly. And his model is probably really good for training AI, but maybe less effective for training therapists. And behavioral model is absolutely crucial because I keep telling my therapist we are now competing against AI, and that is a very, very serious threat and also potentially advantage. So as therapists, it's galvanizing us to improve our skills. Let me move. And the therapeutic relationship, of course, is important, but often it's kind of, nobody really names why it's important. And the natural reinforcer is seeing InFab as a mechanism of change for client growth. And also it allows us to grow. So this is very Mavis language. The heart of both therapists and clients are touched through this work. And that is important because, as you know, if you come from a CBT approach, it's really easy to burn out with CBT because it's just not rewarding. We're treated like robots. We have to impose a protocol on our clients, and then often we find that we fail because nobody fits into a standardized protocol. So you end up feeling like you're a shit therapist. Yeah, so to be able to learn the art of interacting in a therapeutic and effective way makes the whole therapeutic approach much more rewarding. And FAP, of course, is process, and we'll cover key clinical tools. Um, and therapist has to learn to respond contingently to clients' daily problems. And we shape improvements in the session. And this is really quite powerful and really struck me because for the first time, I've encountered an approach that recognized that I exist in the room. Often we learn approaches that almost treat us as if we are invisible as therapists and don't really harness our presence. FAP, of course, takes us and our existing our behavior into the formulation and in a way much more true to the contextual nature of therapy. And we're encouraging clients and therapists to take risks and to grow together. So there's a mutual perspective taking, and that's baked into the approach. So expert therapists often say, we learn just as much from our clients as our clients learn from us. And we can really understand that process when you look at the detail that FAP focuses in. And of course, it's transdiagnostic, it's process based, and it can enhance and supercharge almost any type of therapy intervention because it's fundamentally a process based formulation, right? So when you're learning FAP, you're basically learning how to formulate, how to build a behavioral model. So should we reach across into the chat?
Yes. We got some good answers here. Let's see. So Matt says having tools to work with challenging client relationships.
Yeah. Okay,
Uh,
cool. So
Lewis,
that's
yeah. Do you want to give people a moment to expand upon it, or should I just kind of read through the chat, Tien?
Let's read. Let's just read through. Then maybe we'll go back to that. Go for it.
Lewis Knight says, I generally work as a clinical behavior analyst with a focus on ACT. I think the toughest thing for me is getting people moving when they are very comfortable in their comfort zone. Young people who are in that failure to launch range, for example, when trying something new, especially something social, is highly aversive and easily avoidable, and relief is immediately, consistently available via just going back to the room and getting on a screen. Hashtag
Oh.
relatable. And then Lisa says, when clients share anger and then can direct anger towards me as a therapist if they want me to get rid of their anger.
Oh, yeah, really, really good ones. So they're juicy examples that we'll come back to. So what's the learning objective today? Mainly, I have enough time to maybe offer you a taste and experience of what it feels like to receive FAP and also to, I guess, apply FAP to your treatment. And so also I want to expand your emotional behavioral repertoire to help you understand how you show up in the room and potentially maybe some blind spots that you need to work on in order to evoke behavior from your clients. And of course, give you a little bit of idea of how to implement FAP principles. So let's see how much we can cover today. And so coming back to the functional analysis, and I'm hoping that would be familiar to most of you here. So the good old ABC. And of course, in most approaches, we are looking at the antecedent, the history, behavioral pattern over time, and remembering that we are also bringing our learning history and us being in the room, we serve as the discriminative stimulus in the room. And often that piece is lost, and FAP brings that back in. And what's the behavioral part? The behavior is, well, let me come back to the behavior. And of course, the consequence, we ask clients questions about, when you do this, what happens? So we do assess consequences, right? Now, the behavior piece is interesting because in CBT or even in CBT, we often look at the behavior outside the room. Right, we get them to do a vicious flower, and when you did that, what happens? And you do the chain analysis. But in fact, we take a step back, we zoom out, and we look at what is going on here. What is happening in my interaction with this client? What's getting invoked in me? The therapist becomes a barometer. And we are barometer in ourselves. We gauge our behavior in the room to get a sense of what's happening. So, in the moment behavior is shot of this moment because behavior is constant stream. We're always behaving and reacting and then becoming the antecedent to somebody else's behavior. So, of course, bearing that in mind that when I consequate a behavior in a client, then next time, if I'm offering them reinforcements, next time they see me, they're going to like me a little bit more. They're going to want to come back, right? And I become an antecedent that potentially can evoke and have more influence over my clients. So that's really, really important. What is therapeutic alliance? Therapeutic alliance is my ability to become the the SD, not easy to say, the SD for my client to evoke the behavior that is helpful to them. Okay. And also, if I talk too fast, please tell me to slow down. I get a little bit too excited. So, oh gosh, that's really bad. White on white, apologies. So, of course, where do we enter as therapists? Um, yeah, where do we enter? Well, we have 2 points of contact to play around with the behavior in the room. We can elicit their emotions. We can create an emotional experience for our clients, and we can evoke client behavior, or we can consequate their behavior, right? So this is the precision that we're working at in FAP. We think, okay, how can we change behavior? There's 2 points. So this is what we're going to be diving into and show you how FAP sort of play around with antecedents and consequences. So just to give you some quotes from the masters in the field, behavioral principle-based intervention in which Therapeutic change is produced by therapists contingent responding to clients' behaviors in session in the context of a meaningful, intimate therapeutic relationship. And that is important because, of course, we're using natural reinforcers as the reinforcement, right? And in order to do that, we have to, well, I want you to ask yourself, hmm, are you good at expressing these natural reinforcements? And we all have different ranges, as we will go into in a bit. I'm Chinese, and it was actually quite tough for me to learn to be warm and fuzzy. I'm much more practical and functional and pragmatic, and I have to really shape my experience over the years to be able to adapt to people who are warmer and to be able to model warmth, to be able to model compassion, to even learn how to hug, because physical contact is like, oh. So another question now, I want you to think about yourself. So when you show up in the room, in a therapy room, there's two versions of you. You have you, whatever that is, and you might have a therapist self. And what happens between this self that maybe is out there in your social world and your therapist self? Does it sometimes feel like you're in tug of war, or does it feel like you're compartmentalizing these two selves? Right. So just take a moment to kind of sense that. And maybe ask yourself, are there certain behaviors from me that I probably wouldn't want to show up in the therapy room? And are there certain therapist self that you don't bring out into your daily life? So, because FAP demands us to be natural reinforcers, this is where it becomes a little bit interesting because should there be a division between, self and therapist self, and how big is that division? So, how many of you have felt fear about being yourself with your clients? So, about what does being too personal and being too intimate mean for you? So, Tim, you have a question.
Sorry, I meant to raise my hand and say yes, I felt fear.
Oh, sweet. Yeah. Okay, that's really nice. Yeah. So that'd be interesting. So what? Raise your hand if you feel that. That'd be quite nice to see in the group. Good point. And how many of you feel like you can be yourself in a therapy room? Right? I should do one at a time.
I
And
feel
then,
like I feel like I can sometimes, but this is Paul. Um, but I also like find myself getting caught up in like, oh my gosh, I'm breaking the therapy rules that I learned, like about kind of what you're talking about with like more CBT or like, that there's sort of a stance that I've been trained to take. And so that'll kind of bring up a little bit of tension or anxiety for me at times. And then there's other times where it's like I really like this is the thing that makes sense. So I
mhm.
kind of go back and forth.
Yeah, I think you summarized that really well. I think most people try to exert some sort of freedom in that. You can't be a cardboard cutout and a robot in a therapy room. So often we move from one way or another. You kind of want to bring in your own personality, and sometimes our personality do come into the room. But certainly from my own training, CBT, and being in Britain, I mean, you guys are lovely. But yeah, the British room's even more reserved. So most British therapists have this professional face, and which I really can't stand. You have the social smile, the professional face, but the smile doesn't really discriminate. Whatever I do, I get that smile or the flat face. So it's quite actually off-putting. So just kind of for a moment, appreciate our learning history as a therapist, and also ask yourself, can you represent an approximation of the client's social environment? Because we don't consider that. And sometimes we come into therapy room thinking we have to be the perfect therapist, we have to be this great human being, the warmest person, or maybe the smartest person. Uh, but is that really useful? Is the client actually learning social skills from you if you are not the typical person, right? And if you're really nice and considerate, but your client is struggling with their social environment, how can we bridge that gap? So these are, actual really important questions we need to ask. How can the client generalize the behavior outside if we set them up to experience paradise? So what does that look like? Blank states and professional face are outdated, and FAP, learning FAP, kind of really broke that down for me. And FAP asks therapists to have the ability to show care, to evoke pro-social connections. So we need to be able to model that behavior, because if we're not modeling, how can they learn, especially if it's not in their history? And not only that, because this is where we deviate slightly from potentially Mavis's version of FAP, because Mavis very much pushed the warm social connection piece. But it's interesting as we sort of expand across cultures. I have a German therapist that comes and said, and actually Glenn Gallahan, he's developing FAP too. He's saying, well, actually, that's not really useful because we are losing the context. Because maybe for some people who are warm, what they need to do is actually pull back, right, to be able to set boundaries. And just pushing the warmth and the care range of the behavior actually isn't very helpful. So I think that shows Mavis's history, maybe saying it's mine, because we both come from a Chinese background. That is the repertoire that we need to push, but it might not necessarily be the repertoire that other cultures necessarily needs. So I think we always have to put, all your trainers into sort of context and take it with a grain of salt. And but we do need to have that ability and offer positive reinforcement to clients' target behavior. And to be fair, I think most of us come from quite an aversive attachment history. We often, even me as a parent, often highlight faults in my children rather than reinforcement. Okay, I'm speaking for myself. Okay, I often criticize because that's my background, tell them what they need to do better rather than use positive reinforcement. So if you're that kind of person, then actually learning to say these things and to be able to bring out what's working is a conscious skill that we have to practice. So just kind of giving you the flavor now. So let's dive into the rules of FAP. So bear in mind that FAP was developed watching expert therapists. So these are all intuitive. When you're brilliant, you're already doing this, right? Which is brilliant. All it does is really spell it out so you can now know what's underneath the hood and maybe start using it intentionally and use that to formulate all sorts of things. And it becomes really interesting. So, of course, awareness, right? And we all know that. The first step of therapy, if the client and the therapist can't see what's going on, then of course we can't start maneuvering the levers or the dials and start making changes. So we need that awareness piece. And this is where it, I think, is really different, the evoke piece. We are evoking, of course, we set clients things to do. We talk about, we make recommendations, especially if you're a CBT therapist. Why don't you try doing this as behavioral experiments? But the evoke that we do as a FAP therapist takes courage. And I think, Paul, you sort of said something similar along the lines that we actually have to show up and disclose their impact on us, right? It's like you telling your friend, you know what? I kind of feel like we keep having this one-way conversation, and it's starting to really annoy me, right? For us to say that to a friend, certainly for me, it's really, really hard because it increases confrontation. And to do these kind of moves with the client might evoke more anxiety for us as therapists, especially when we're trained to be sort of impartial and not to offer too much, not to be too directive, etc. So certainly for my sort of early career therapists, they find that the evoke piece very, very hard. And of course, reinforce, a lot of us actually maybe find reinforcement a lot easier, because we're trained to be reflective and be encouraging. And again, therapist awareness, rule 4, that's a biggie for me, because for the first time I realized, oh my God, I am recognized. I'm seen in the room. And this is a really crucial piece, because as we become therapists, hubris also increases, our own arrogance, our ego. And we think we're being great therapists, but often we don't ask for feedback. And I had a shocking feedback from a conference that we had here in London. And I was talking to a British therapist, and we just did a presentation on FAP. And they said, you know what? It's amazing. I've never heard a presentation that asked that, where the therapist asked the client for feedback. And I thought, really, really? Because for me now, it's like, this is just what we do. But to never ask the client for feedback, right? So maybe just ask yourself, do I check in with my clients? Do I ask for feedback? And again, that goes into evoke. And you might think, oh my God, right? Can I sit with clients' feedback? And it is really, really hard when we evoke that. And then rule 5 is interpret and generalize. That might be familiar to you, because we're very good at sort of giving a summary to our clients. But this is really about, if you come from the ACT or ACBS perspective, I would say it's getting the client to describe their experience in the session with you. Can they put their experience into verbal instructions, right? So what was impactful for you today? Oh, I felt when we practice, maybe when I have to say this to you and I was really nervous, and you encouraged me to express my needs, that was really helpful. Okay, what did you learn about that? What did I do that was helpful? So we really break it down for them to sort of isolate the pieces that make sense to them. And then next question is generalize. We need them to do this outside of the session. Otherwise, this is where therapy doesn't work. It shouldn't just stay in the session. They have to take the change outside. So how can you do this outside? Who would you do this with? Right? So we set the homework very organically. So we'll go into that piece by piece now. So starting with awareness. I mean, it sounds all very easy, but this actually becomes quite complex, because in fact, we look for clinically relevant behaviors. So what is clinically relevant behaviors? These are behaviors that potentially may show up in the room, in the relationship. And I guess if you come from a psychoanalytic background, you sort of think, oh, this sounds like transference and sounds like counter-transference. Yes, it is, but they describe it theoretically in a different way. And for us, it's just like, yeah, because our learning history shows up in the room, right? Our brain's a clever thing. It likes to follow routine and patterns. So when we've adapted a relational pattern, it shows up everywhere. So we want to start seeing relational patterns show up, and it's a sorting game. We just want to watch what happens. So in sort of natural everyday language, that looks like noticing, mindfulness, being present, empathic connection. And empathic connection means when we watch somebody cry, we recognize the behavior and our mirror neurons kick in, and it makes us feel what they feel, right? And that's an empathy pathway. So when we're tuned into them, all these processes happen, automatically, especially as you're a very skilled therapist. And in behavioral language, what it sounds like, it's basically discriminating our behavior and its impact on others, right? So we learn to discriminate, and that's an important skill. We notice what responses may be reinforcing or punishing. So that's for the therapist and the client, right? So when we do something, what's the response? If we can't see that, we don't learn. Consequence is really learning, right? And learning what's workable. And we recognize 2 different behaviors as part of a functional class. This is a little bit skillful, because when we see 2 different behaviors, they might serve the same function. And as a FAP therapist, you learn to look at things in terms of function, not superficially, not topographically. Okay. So what are we looking for? So first of all, behavior, it's actually quite simple. All organisms have two basic functional behavior. We either go towards something to get something, or we move away from something, right? And when we go towards something, we kind of know that the context might contain something appetitive. So already just doing this basic thing, you're formulating. And when we move away from something, then you know that in environment, there must be something aversive going on. That's it. So knowing that, you can do a pretty damn good formulation. So if a client is doing behavior that looks like they're moving away, or you feel like you're being pushed away, then something aversive is going on, right? If both of you are starting feeling like, oh, I'm getting really connected and pulled in, then there's something really appetitive happening in the interaction. So we're just really widening our awareness just to notice that. So that's a good foundation to start with. So as I said, appetitive in the environment, aversive going on. Okay, so that's your basic behavioral science. Now, coming back to your own experience. So let's look at your awareness right now. So as you're listening and watching me, you've never met me before. Some of you have, and you're bringing your previous history of interacting with me into the room. Kind of what judgment? Can you just notice the judgments that you are making about me? All right. So allow yourself to notice this, because we all make judgments. So maybe that judgment might be different from the first moment you saw me, just a picture, to now, 20 minutes, probably 30 minutes later. So just kind of get a sense of that inside. And ask yourself, how helpful is this judgment if you want to get to know me more? Right? So the judgment might actually make you more curious, or it might feed you down one side. It might ask me certain questions, or it might pull you away from me, because I might remind you of, somebody that's been aversive to you in the past, possibly. Okay, so just getting a sense of what you are bringing into this relating with me right now. And can you notice your pattern behavior when you start a new personal relationship? Okay, there was supposed to be a poll, but there's not going to be a poll. But maybe just notice, is there a relationship pattern? Do you tend to be quite cautious, tentative, hold back, watch? Or do you kind of just dive in, like a really enthusiastic, excited person? So maybe just get that. And if you want to share it in the chat, you're welcome to. And yeah, I don't know, Max, if anything interesting in the chat that you want to flag up to me, welcome, because I can't look at both.
Yeah, well, yeah, everybody feel free to, I know Tien would like this to be as experiential as possible, so feel free to, yeah, like speak in the chat, and we'll read them out loud as they come in.
Okay, so as you notice these patterns, then ask yourself, when you go into a new relationship with a client, what do you bring into the room? Right? Do some of these patterns sneak into the room? Do you tend to sit back and kind of watch and see what happens? Or are you quick to jump in and maybe want to please, want to help, be helpful? Or do you want to be quite directive or dominant? So maybe just take a moment to reflect on that.
Yeah, we have a couple comments. Paul says, very cautious. And then Christina agreed. As a neurodivergent person, I'm always like, oh, looking around, eye emojis. And then Jason says, I sort of feel it out. Generally start out cautious. So cautiousness seems to be a theme here.
I think, yeah, okay. So it's interesting. So that is what we bring, and that's exactly rule 4. Therapists, what are we bringing to the room already? Because don't forget, then we're already starting to shape behavior without even realizing, potentially, or model behavior to our clients. So let's come back to clinically relevant behaviors. So it's kind of a sorting game for the FAP therapist. We are trying to discriminate behavior in the room. And oh, does it come up? Yeah. So there's two types of, just keep it simple at the moment. There's two types of behavior that we're interested in. So CRB1 is what we call problematic behaviors. So behaviors that doesn't serve the client. So i.e. in depression, it could be functionally equivalent to their depressive responses outside. So that might be being quite withdrawn in session, or you might see a lot of self-criticism come up in session. Detachment, possibly sense of helplessness, passivity might be there, showing up with you. So it comes in. And we also look at CRB2s. So twos are improvements. And we need these responses to be functionally equivalent to helpful behaviors that they can engage in outside of their session into their day-to-day life. Right. So if I have a depressed client in front of me and they're feeling just out of control and helpless, maybe one very simple question I could ask, evoke would be, what are you in control right now with me? Right. You're sitting here with me. Are you in control of that? Because you can walk out if you choose to. And you just answered me. Are you in control of that? So do you see, we use that behavior in the moment again and again, and then just building that up. So I'm evoking these CRB2s to just highlight you do have control, and guiding them back to that sense of competence and autonomy. That's very necessary in treating depression. Yeah. So CRB1s are problem behaviors, whatever they're stuck on. And CRB2s are, helpful behaviors that they need to take out the room. Okay, is that kind of clear? I hope so. Any questions, please put your hand up. And Max, if you can keep an eye up, because I have to minimize the screen.
Yep.
Yeah, so just shout if you have any questions. So again, because we're doing functional analysis, we follow function, not form. Okay, so, and we don't get stuck in content, so be very careful. Behavior, so what does that mean? Behavior can look differently. Behavior that look different can be functionally equivalent. So you can see three different people here. One, she looks like she's shouting, I think. One's very withdrawn. The other one is laughing. So if I ask, okay, what is that? If you see that in session, what would you hypothesize? Well, that's quite hard, right? But what if I tell you there are three different expressions of avoiding intimacy? Because they can function as that, right? Somebody always telling jokes. You can't get to know them. Somebody will shut down. Somebody will get angry. They all push you away. So it's learning to avoid to spot the function. Of course, same behavior can serve different functions, right? The behavior that looks the same. So two people laughing. What does that mean? One can be avoiding intimacy. One could actually be creating intimacy. So it depends on the context. And so it's that level of awareness that we're really we're practicing. So just a recap, we're looking for problem behaviors and we're looking for improvement behaviors. And that is really hard. That's probably the hardest one, actually one of the hardest thing for a FAP therapist to get their head around is how do we do that? Because it's basically doing ideographic formulation, moment to moment to moment. Because Bob Kohlenberg is, of course, he's the hardcore behaviorist, and he's a Skinnerian, and he's from that lineage. So that side of behavior analysis, he doesn't want to lose. So there's always an argument between him and Mavis about, how can we generalize this to trained therapists? Because if you do pure clinical analysis, you'll lose people, right? You'll lose people. So, but I'll help you with that later. So the thing is, how do I know if it's a one or two in the room? Well, generally, there's a rule of thumb. Clients' daily life problems that can show up in sessions. So they'll tell us, what do you struggle with? Where do you get stuck? And those, hopefully, and if you're a skilled therapist, you can bring some of those problems. It will show up in a therapeutic relationship. So in other words, we can call it transference if you want to see it in that way, but obviously different theory. And behavior that keep a client stuck or unhelpful behaviors in certain contexts. So we'll see that as CRB once. So what are target behaviors? Just improvements, anything that move clients towards a goal and value. So this is where we can bring in ACT. Well, we'll go into that in a bit. So anything that's pro-social, anything that help the client connect with the therapist, because they're learning connection skills. If they connect with us, they can connect with other people. And if they can be more assertive with us, that can also help, right? So really, context is everything here, because we don't know the function unless we analyze the context. So coming back to functional analysis, what are the contexts we need to look at? Well, obviously, there's a context in the room here now. Right? When a behavior gets evoked, you have to ask yourself as therapists, is it me? Or is this coming from the client's learning history? Right? Because if you're evoking clients' intimacy or connection behaviors, you have to be really careful. Are they only able to connect with you? And if that's the case, you've got some boundary issues going on here, right? And if you're not generalizing this outwards, then it becomes a unique relationship and ultimately not helpful and ethically not helpful. So when you evoke a behavior, it's really important that you have to ask yourself, like we said before, can the client actually generalize this behavior in their day-to-day life? And also culturally, this is really, really important. If you have a client that comes from a very collective culture, and you're saying, no, you need to do what you believe in. You have to live your own life. You have to consider, if they start doing that to a degree, they might be rejected from their community. Is that really helpful? Right? So we have to always analyze the behavior with context in mind. And also when they start to do something different, you always have to ask yourself, are there reinforcers in their outside world that's going to help them? You can't set them up to go out with a new behavior and then they're going to get punished left, right, and center for changing, because that is going to be really, really quite horrible. And you're setting them up to fail. So yeah. So I guess I'm gonna do a quick demo here, and for you to just start practicing looking at the CRBs, and I might pause it and maybe ask the audience, can you recognize maybe problem behaviors and helpful behavior showing up in here and now? I need a volunteer really quickly. So who want to play? Oh,
I see two hands.
okay.
I saw Lewis. I saw your hand first. I apologize to other people, but that's where my eyes went to.
So Lewis, nice to meet you.
Like you
And
too.
so I suppose I'm going to give you like a wrapper to make sense of this little short interaction. Can I ask you maybe to think about a therapist avoidance? Are there anything that you tend to shy away from or avoid maybe addressing or do in a session, if that prompts anything, or maybe in your personal life?
I mean, it's contextual. If
Yeah.
I've got, and I work with a lot of younger folks, so this tends to be dads. If I've got a dad in the room, if he's kind of like physically larger, maybe a little older, and this is very hard to describe, but if he's got kind of that aura of poorly leashed violence about him, I
Mhm.
don't want to make him mad, even if there is certainly like no real risk of violent interaction. Like he'll accelerate his behavior and I'll pretty reliably shrink.
Mm-hmm.
Maybe even kind of, I really hate this, but I might even lean toward like a fawning kind of response. And that comes right out of my learning history.
Mm. Okay, so that's really helpful because I was about to ask you what do you mean by shrinking back and avoiding that? So you feel like you have to make yourself smaller and
And
less intimidating.
like, yeah, yeah. So, I mean, you could maybe make an argument for like, mammalian dominance type of stuff, right? Mammalian submission type of stuff, but also just like verbally to kind of get more soothing, get more reassuring. Oh, oh gosh, I didn't mean to upset you there. Uh, Kind of trying to lower the emotional temperature in the room. And the whole time I can tell myself I'm being an effective therapist by doing this, which is really great because I may or may not be.
Okay, so what kind of I guess what kind of experience comes up in you when you're with this person, with somebody who's very dominant, aggressive, and with females, it doesn't evoke the same thing if you get a very dominant, aggressive female.
No, not so much. I'm much more comfortable with that.
It's much more with a male. Okay.
Okay.
Okay. And how is it talking to me now? So obviously, I'm not an aggressive male. How do you feel being with me?
Feel fine.
You feel fine. So what is fine?
It's pleasant to talk to you.
Okay.
You're enthusiastic. You're enjoying what you're doing. Um, you know what you're talking about, as far as I can tell. Like I always like that kind of thing when I'm talking to somebody who's got this content understanding and they're expressing it really clearly. Like that's like catnip to me. I love it.
Okay. So also, can I invite you to just kind of checking on your body? Do you feel like any of that shrinking, kind of fawning, appeasing behavior is present in you right now?
No, there's a nervousness because at least kind of metaphorically, we're in a room and everybody's staring at us.
Okay. So I'm
You're
gonna oh, so there's a bit of that, but I can understand that. So I'm gonna pause us a little bit there now. Right. I'm gonna ask you, the audience, can we see any CRP ones or twos in the room right now? Anthony?
Well, there's not the shrinking,
Yeah.
so CRB2, I would guess.
Yeah. That's really good because sometimes this is where therapists get slightly stumped. It's like, but this client is okay with me,
right.
right? So yeah, because you're feeling fairly safe with me and you don't feel like I'm going to dominate you. So the CRB2's in the room with us. And that's a great thing. So tell me, Lewis, how would you like to be in that situation you talked about? So
How would I like to be in a situation where
it's dominant man, slightly aggressive.
there's
Yeah.
a little bit of I don't know, right? Because this is kind of a relatively unexplored territory. But I think what I'd like to do is not how to put this, be more straight across, not be so soothing, not slip into creepy therapist voice. Um, all that stuff. Just kind of stay with, I guess, stick
Yeah.
with it. I don't want to get into a monkey dominance game with people. I don't think modeling that is a bright idea, except maybe in very few situations. But it just doesn't really come up. But just kind of continuing to do like what I'm doing here, where my kind of tone of voice and cadence of speech remains the same. I'm trying to make some kind of reasonable point, but I'm not like, well, hold on just a minute, that kind of thing. I don't want that part.
Okay. So can I get you to, I mean, you basically got there. You're aware that you are talking like this to me,
Okay.
right? So what feels grounded and what feels still in you right now?
That is difficult to answer broadly.
Just take a moment, dive into your body.
Just that I'm present, like I'm here, sitting in my chair. It's
So if you
holding.
if you take a few breaths and if you track your attention inwards as you breathe in, kind of just notice, is there any part of your body that feels Oh, it should just give you that sense of stillness, like I'm present.
Not to get too stereotypical, but like I'm just right below my belly button, like Don Tien, that
Okay,
spot.
that spot. Okay. So kind of just notice and sending your attention to that spot. And you're welcome to put a hand on there too. And just get a sense of that right now. You are just feeling very comfortable, very present, very regulated. And allow yourself to be.
And so that's there, and then also like again, kind of like that nervousness and tension is also there because we're still doing this. Another thing that I didn't mention is I really hate exercises like this. They drive me crazy because there's like a part of me that keeps saying this isn't real. This isn't like how people actually interact in the moment, But there's a simulated piece here, and that always feels like I don't quite know how to act because uh, all the normal antecedent stimuli are present.
Okay. All right. So let's pause here. Now, any behaviors you're all seeing? So any CRB ones or twos happening? So shout out or stick in the chat, then Max can help me.
So I was gonna say, I don't know the function of the behavior, but I did notice just body language shifting a little bit. And Louis, thank you for being here today to, to let us observe. But the hand on the head, hand on the face, so that could be functioning as comfort, or it could be functioning as relaxation, or there's questions. I don't know which, if it's a CRB one or two, or if it's deferring. Sometimes that's a way to show that we are letting someone else take the lead a little bit. And then when you went into your breath, just coming back, you kind of sat back, and there was a different kind of behavior that, was more just settling in, I think, with some peace. And I don't know, felt a little bit different. So I'm not sure which it was, but that's where I would love to explore if I was sitting with you or sitting with a client.
Right.
So,
Like I think that's always difficult because you can't get the private side, right? Because like part of the reason I'm shifting in my chair is actually because my common bile duct is probably bothering me a little bit, which is a whole other thing.
yeah, so
This
obviously,
function, yeah.
definitely. I think, you need the baseline to get to know your client. How do you formulate really quickly? But if I'm just going to do it really quickly, I would say, okay, we got away. There's CRB2 in the room. You're regulated. You've connected with the part of you that's regulated. And then you started to mention, okay, there's a sense of skepticism, right? And then you pulled away, right? So regardless of the verbal content, because we try to stay away from the content, your verbal content in effect pulled you suddenly away from the groundedness. So it kind of gave me a flavor. Okay, when you come into a situation and if you have to overthink it, boom, your regulation's gone.
Sort of, and that's also a thing I do to regulate myself, but it's a CRB one regulation. It's an avoidant regulation.
Avoid regulation. Yeah. And you sort of said, oh, this feels a bit, it's not something I do. Okay. So really, I mean, Anthony, do you want to quickly question and then I should move
I
on?
would, thank you. I was just wondering if Louis saying I hate exercises like this
Yeah.
is a CRB one.
It becomes a one. Exactly. That's the point where I thought, oh, okay, he's moving away. And it feels for you, it feels like contrived and not a bit artificial. Nobody communicates like that. And so yeah, so that skepticism comes in. So what does CRB2 look like? I suppose it is about well, I would ask, well, is that helpful? Almost, if we going to act, is that actually helpful? And if you're in session as a therapist, thinking like this, is that going to be helpful to your client?
No, that's not advice. That's good advice for me. That's not advice that if I follow it, if my behavior, my subsequent responding falls under its control, that leads me out of helping the
Yeah, absolutely. So I know, let's not dive down this rabbit hole. It's really fascinating, but at least I think you guys get the flavor of, yeah, you're definitely seeing ones and twos happening. And you're getting the sense that I'm panning out, zooming out, looking at the interaction rather than the content. Yeah, so hopefully the flavor is there. Let's jump back in. So what are CRB2s? They are moving targets, okay? So we have to be really careful about rigidity because it goes back to developmental theory, really. If you have children, you'll know that your baby might start eating with her hands, make a bit of a mess, but at one point you kind of want to increase her skill level by giving her a spoon, and she's trying to eat with her spoon and hopefully getting into her mouth. But then when your baby grows into a 13-year-old, you don't want her to be only using a spoon as her only implement, right? You want her to be able to maybe use knife and forks or even chopsticks or whatever. So you can see that developmentally, we want to have our skills becoming more and more sophisticated. So when a client develops a CRB2, so for example, assertiveness, they might not be able to express themselves very well. It might come out quite clumsy. And we have to be able to notice little changes and reinforce these little changes, even when it's clumsy, and not punish it. And then when they finally get somewhere, we slowly shape it up. So it's a successive approximation. Okay, so hopefully that makes sense. Any chat I need to be aware of, Max? Or were you good?
We're okay. I mean, there's some questions, but maybe I don't know if you want to kind of field them at the end, or if you want, we can pause for a minute.
Uh, what do you think? Are they relevant for now? We're kind of halfway through, so maybe shall I take a couple?
Yeah, we can take a couple. So the most recent one was from Anthony. Does a FAP therapist ever intentionally evoke CRB1s?
Very good question. So potentially, yes. In certain situations, if we are struggling to bring out the twos. Yes, I have to think of a good example of that. Da, 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 da. Okay, so if I have a client that keep telling me that, actually, can somebody give an example? So I'm gonna multitask.
Let's say a client keeps you avoiding intimacy by like making jokes, using a sense of humor.
All right. So if well, in a way that probably will come out quite easily. So okay, let's say that they actually show me the serious side, right? And able to dive deep and talk to me. So in a way, we've got the CRB2 in the rooms, similar situation with Lewis. And I'm not seeing the jokey, light-hearted side, then what would happen? And and I want to be able to generalize this outwards, and it's just not generalizing. So I think I would ask him to either, let's go the easy way, just kind of show me that side. So if I'm your partner, and if you're going to interact with me in a humorous way, and this is where we become sort of like an actor. This is where it requires you, still you, but kind of expanding repertoire. Okay, let's just talk shit about something and build up a banter, and then potentially just kind of observe, oh, how does that come up, and what does that look like? That's probably a difficult example. I think another example might be, I think, conflict as well. They might not come, they might be polite in a therapy room with you or with me, but they're not going to show the angry, short-tempered side, right? So in that sense, I may construct a situation where I potentially disagree with them if that might be evoke, or I might disappoint them in a small way. So we actually create a rupture, basically. We want to create a rupture that we can handle and repair. So I think in that sense, it is helpful to create these situations. Yeah, I hope that kind of vaguely answered that. It's hard to not to answer that without an example context because it's so contextual. Another question?
A lot of the other comments are more sort of reflections on Lewis's role play with
Okay.
you. Yeah, but that was like I think the big question.
Yeah. Okay. So Tim said we punished CRB1. Yeah. So I guess we're going to reinforcement. Let's dive into reinforcement here because we do punish, but how we punish is we basically block behavior. All right, so that takes us into rule 3, love. So how do we reinforce the RB2s? And I think all of us probably can do that quite effectively. We're pretty caring, great therapists. So the colloquial language is showing compassion, supportive, showing appreciation, acknowledging, respect, regard, and of course, providing positive reinforcement is technical language. And we withhold reinforcement when it sustains ineffective responding, right? So if a client, I get a lot of that, if they just talk, especially hyper independent clients, they come, they talk at you, they present the solution, and you sit back and like, oh, there's no space for me. Like, why are you even here? Right. And this is where I would pause them and it's potentially evoke. I would pause them and stop this flow of verbal behavior and get them to start to notice me and track our interaction more. So yeah, so in a way that's kind of a type of punishment. I'm sort of just trying to stop the verbal behavior. And we create a context where client behavior can generate new behaviors. So remember, we also become the antecedent. We want to evoke new behaviors, not just consequent behaviors. So that's rule 3. And this is where I want to direct attention back to yourself again. So this is what I said about individual differences, and maybe get a sense of where your warmth dial and intensity is, right? And Lewis, you sort of said, okay, there's a skepticism about certain type of behavior. Totally get it. And I think sometimes that's related to sort of how much we show up as well and what kind of, hippie stuff we do. I was definitely on a cool end, and I've kind of moved myself to the warmer end. With people I really love, I'm warmer. With people I don't know, I'm sort of in the middle. So maybe just get a sense of that. And if you're all in person, I would get you to line up in a lovely, and just get a sense of the spectrum. Okay, so if you want to share in the chat where you're at, then absolutely. So maybe get a sense of 10, you're really warm, and 1, you are definitely on the cooler side. Just get a sense of that. And we're reasonable. We're not saying you have to be a Mavis or you have to be me or you have to be a Max or a Tim. Tim, I suddenly know you're so warm. And sometimes warmth can actually be punishing for a client, right? It actually doesn't work because I've worked with clients that has parents that show a lot of warmth, but it's actually a taking. Her mother would come and give her hugs and want and just want that warmth. She's warm, I want, but it functioned as taking. She takes care and love from her daughter. So when I say to her, I really feel like we're becoming closer right now, and her immediate response was, "Oh," she backed away. My expression of warmth towards her was actually really aversive to her. I was like, "Oh, I'm really sorry," and it's like, did I just trigger something? And she said, yeah, you just pressed sort of my mum button there. And no, doesn't work. It doesn't work. So I said to her, okay, can we agree on another language? Okay, closeness, definitely out the room. Can we, what kind of word um would you feel comfortable with that basically, sums up how we just got a little bit, we just connected there, right? So we have to adjust that according to our clients. And of course, we have to model just slightly more or even less. Remember, might have to cool them down. Might have to calm the intensity if it's not functional. So ask yourself, are you able to move across the scale to a degree? Any comments or questions there, Max?
We got a bunch of different numbers. We got Jason's a 3 to 4, Christina's 7 to 8, Charlene's a 6, Mitchell's a 4, Gabriel's 8 to 7. So yeah, a lot of got the full spectrum of warmth right now, which is good. I think it's very variety is all a good thing.
Love, yeah, definitely good. So if you wherever you are in your number, maybe ask yourself, okay, what would it look like if I go sort of 3 points down or 3 points up, right? And what is it that I need to work on to just increase my repertoire here? So when I bump into a client that's really warm, can I at least and find warmth reinforcing? Can I offer that to that client, right? And that's important. If it's reinforcing to your client, are you able to offer that? And if you need your client to set boundaries and to maybe even, warmth intensity should be separate dials, separate lines actually. But if you need your clients to be cooler in intensity, can you model that and show them what just pulling back, a little bit coolness, a little bit of assertiveness look like, right? Otherwise, you might be reinforcing the people pleasing side potentially. So just kind of consider what you're modeling. So that's reinforcement. And slightly mixed. So we normally teach therapists reinforcement first because it just comes naturally to most therapists. And then I jump into 2. So rule 2 is courage. And this is where we want to evoke CRB2s, right? We want to bring the helpful behavior in room. So normally as a FAP therapist, like an ACT therapist, we don't go chasing problems, right? We don't want to bring problems into the room. We want to go to the most direct route to the twos. So if I can bring a change behavior, improvement behavior into the room, why do I want to go near the problem? So keep life simple. If the CRB2 is in a room, great, reinforce it, bring out. And most sort of, most clients who are not complex, you can bring the 2 into the room very quickly, reinforce that, and that's easy to do. More complex clients, when you try to get the 2 into the room, you will naturally bump into a lot of 1s, right? Of course, if they can do it, then job done. But trauma clients or more complex clients that's been stuck in their problem for a while, their problem will come into the room. We don't really need to evoke it. Sorry, let me just close my phone. So what's the language here? Being honest, vulnerable, authentic, taking a risk, confronting. So as therapists, these are the things that we need to do in session, and these are the things that we want to encourage our clients to do. And we want to engage in behaviors that may not be immediately reinforced, but are aimed towards reinforcing more effective responses and repertoires. So this is where it's a little bit scary, because when we take a risk, we literally do not know what the outcome is going to be, right? We don't know whether somebody's going to reinforce it. It might get punished. Yikes. So it's sitting with the unknown, and it's sitting with the potential of confrontation and conflict. So as human beings, maybe ask yourself, where am I on the conflict scale, right? Because that will be really relevant to how comfortable you are to evoke CRBs. And to not escape aversive states. So as therapists, we really have to sit there. We can't have negative reinforcement like, okay, let's just talk about the situation some more, right? And go back to content. Because as a FAP therapist, if we get stuck in content, that's basically avoidance. It means we're just talking and we're not doing. Just a little bit technical. So what does that look like? When we evoke the CRB, we're basically becoming the antecedent for the client. So let me just remind you that the client is coming into your space, right? Maybe literally physically. And when they come, they are looking to you for help. So immediately you're given the privilege, the position of being a guide, a Sherpa in their life. That's already assumed, and you've already been granted that influence. If you start offering your friends if you start to basically give your friends feedback, it's a total social fail. Believe me, I've been there. I'm a bit aspy sometimes. I'm too direct. And in a social situation when you're direct, it's not a good idea. But in a therapeutic situation, when I am actually direct and actually describe what I feel, that is actually welcomed because that's what they're there for. So the context protects you in a degree. So we want to bring the behavior into the here and now. We want to move away from content and go into process. So really simple. You hear me say right now a lot, here and now a lot. Basically, it's anything that's happening now, right? No brainer. Do you notice how you got really quiet and gone inside in the last minute? What happened? So with Luis, in that demonstration, oh, I noticed when you put your hand on your just below your belly and you were just grounding for a moment, you started talking about how skeptical you are to this kind of exercises. Like, who does that? Oh, that's just really interesting. You know, did that feel uncomfortable to do? So I would basically highlight what happened, right? I can't assume I know what happened. I just highlight it so we can both look at it. So now this is less scary than it looks. So in order to help FAP therapists work out what's a CRB 1 and 2, I told you that's really hard. We can't be doing a fresh formulation every single time. And what's the point? Because there's a lot of theories and already approaches out there that can help us. And FAP is a process, right? And where we can pin a lot of other things on. So FAP is intrinsically an interpersonal process. Interpersonal is baked in. So we can try to understand, well, what is the function of interpersonal behavior? And Glenn Gallahan, I don't have a reference here, or did, it's disappeared. He came up with 5 classes of interpersonal behavior. So fundamentally, interpersonally, what we're trying to do most of the time is we just need to let somebody know what we need. We basically have bidirectional communication. We give each other feedback. When you say something, I say something. I say something, you respond. So there's this thing going on. Or we get into a situation of conflict and we have to resolve conflict. Or we talk about very intimate things, and that that kind of conversation comes up between people who are very close. Or if you have that conversation, it brings you closer. And of course, while we're doing all of that, we're constantly emoting and expressing to each other in our body language, right? So he basically summed it up, which is really quite helpful. His new stuff is even more interesting. So, but coming to FAP and we'll teach you. So that classifies interpersonal. So if these things are CRB2s, if we can do them effectively, then ineffective interpersonal behaviors then naturally are 1s. And of course, we can spot that even in our friendships with each other, right? So attachment theory is super helpful. It's another interpersonal theory that we can map onto the process. And there's a brilliant article, a behavioral attachment from behavioral perspective from, is it Cordova, Mendoza? I can never remember references, but if you want it, I can share it. Attachment is basically reinforcement schedule. Brilliant. If you get, it's like proportional of punishment versus reinforcement, then you become anxious attached. If it's almost, just more punishment than reinforcement, then you're always slightly anxious because you don't know which one you're going to get. So these interpersonal theories will help you identify CRBs and sort CRBs. And then intrapersonal approaches are useful. So this is where ACT comes in. CBT can be useful, schema therapy. So you don't need to throw away the stuff that you've already learned. You can just take that to try to help you look at behavior and understand it, right? And ACT, of course, fusion is basically CRB1. If we don't have any sense of direction and be able to name our values, that could be a CRB1. Yeah, does that kind of make sense? So we can bring those in to help us see what's going on in the room. So next questions. Are you a shy therapist? I think, I can't remember who said, yeah, it's well, I mean, Lewis, you sort of mentioned dominance. Often, especially beginner therapists are quite shy and they're still bound by social rules. And it's hard to shed, oh, I can't ask that. It'll feel really rude or intrusive. So checking time. Good. So I've got a nosy question time, right? I want you to just look at all these topics here and just ask yourself, like, what would you find hard to talk about? And what would you find hard to ask another person? Right? And sometimes money is like, I put a top, money is actually the worst thing. People are really shy about asking about finances. And actually, we know that financial issues are one of the biggest causes of mental health distress, right? But how often do we address that? And especially if you're a private therapist, how often do we ask, especially when you hear their circumstances change, do you sort of think, can you afford me? How are you doing this? Do I need to consider how you're paying me? And that is actually that's an ethical question. If they're clocking up the credit card to pay their therapy sessions, I would be worried. So sexual preferences, and sometimes we have to ask the question first to break the taboo, because if we don't ask, they won't tell. Has something happened to you? Have you experienced sexual abuse? Has anything happened to you that makes you uncomfortable? So I don't know. I mean, if there's anything else on the list or any comments about this, Max, please, or please share. Are there other topics that are taboo for some of you? Politics, I think, is probably a big taboo in America right now. Okay, so just kind of think about that. And are you bold enough to address that? Right? And are you bold enough to adapt to a dominant client who takes over the session? So therapist assertiveness is a big area that perhaps isn't addressed enough. Can you and the skill that's probably underdeveloped when we go into the therapeutic world, right? Can you describe what you see? I noticed that you just pulled away, or I noticed that you kind of just spread yourself out in the room. Right? Some clients, it's really interesting. Like, they just get themselves very comfortable. They come in, they're very entitled, and they chuck their coat there and their bag there and literally take over the room. That's really relevant because we're watching how they interact and how much they, yeah, like you said, the monkey kingdom, right? We're looking at their dominance behavior. And are you brave enough to describe that? And Lewis, I suppose, with a dad like that, it's like, oh, I noticed that I'm feeling, I suppose, well, that's quite a bold thing. I notice I'm feeling a little bit intimidated. And when is, and I wonder if that's how you intend to, that's the impact you intend to have, right? That's quite confronting if you can actually say that out loud, but maybe he doesn't know, or maybe that's an interesting evoke in itself. right? Maybe that's the atmosphere that the family revolves around. And can you create closeness and connection? Some people are shy about doing that or skeptical, but in order to create closeness, we're evoking intimacy behaviors, and we're seeing, do they have those skills? Can you disagree with your client? And I'm not really sure about that, right? When they say, yeah, I think I think I listen to people. But actually, when you gave them feedback, you notice that they didn't really register. So you kind of want to test that out, you know. Um, so do you listen to me right now? Because I feel like sometimes you don't quite register that I'm in the room with you. I feel like you're doing the work on your own, right? So these kind of responses are really quite confronting. So can I just get a sense, I mean, in the chat, how many of you are doing that already? Do you feel like, yeah, I can do that? I can be quite direct and I give uh, feedback on clients' impact on me. So I notice I'm intimidated by you. I notice that I'm drifting away. I feel like we're really stuck on content. And I notice that I don't really have much space to support you right now. So yeah, just share if you do that already. So just kind of notice your own passive aggressive scale on either end, right? And the degree of control you need in the session. Okay, so anything interesting there, Max? I can see chat
Yeah.
now.
So Jason says, I'm not doing enough. Michelle, yes, mindfully. Gabriel says, I've been dipping my toes and slowly doing it.
Mhm.
Sanjaya says, with some, but not all.
Yeah,
Chris, I can't say I've struggled with this, but it's definitely good to be mindful. Lewis, I can struggle with these, but the reflections of how the client is landing are easily among the most powerful tools I have. Plus, it gives
yeah,
them a sort of informed consent about their own lives.
absolutely. And of course and when you say I can do it with some clients and not others, that's really interesting because then we have to ask ourselves, okay, what are we getting evoked? How are they evoking us, right, in the session? Because remember the function analysis, there's actually two going on: the function analysis of the client and the function analysis of the therapist.
Mhm.
And when they come into the session, we start the dance. So we lead the dance. We're the antecedent. And we want to just get a gauge of their CRP ones and twos. And then by the end of the session, what we want them to do is become the antecedent in their life, right? Be the change you want to see. Is basically become the antecedent. Can you evoke behaviors from other people in the way that and construct your life in the way that you need? So it's becoming really proactive in their life. That's how we want them to leave. And hopefully by the end of the last few sessions, they basically are doing their own work. They're coming in, they are evoking really lovely interactions between the two of you. They're showing you how capable they are. Then it's time to say goodbye. Now, if they're coming in and evoking all of your ones, then you're in trouble. And if you're reacting to your client, then they're the one in charge, right? They're leading the dance right from the start. And that's not going to be helpful because you're basically reinforcing their ones and they're reinforcing your ones. And both of you go down the rabbit hole.
Tien,
Right. So,
there's a few more juicy ones. Do you want me to read them or do we want to circle back later?
oh, no, let's go for the juicy ones.
Okay, spill some tea. So Tim says, it's not always intuitive and can be confusing for me. I often have to take a step back and consider it, especially a tougher interaction. Paul says, I feel like asking where I do or don't do these is helpful.
Yeah.
Mitchell says, I can lean into being warm with clients, but I wouldn't tell them I'm annoyed or frustrated with them
Mm-hmm.
yet. So after you preach in. David, I do this on occasion after my awareness of what has happened in the room is delayed and have to decide whether or not to go back that moment or wait for the next one. And he got some likes on that. I
Yeah.
think Christina says, I work with a lot of queer, PGM, neurodiverse folks. It's kind of
Mhm.
baked into our ways of being in a relationship with each other and always room for more growth. And Paul says, it's fascinating. I haven't thought much about what they're evoking for me.
Yeah. Okay, so it's good. It's generating thoughts in yourself and how you work in the room. And it's anecdotal, but I've found that when I work with people who has very weak attachment history, so very volatile attachment with their parents, or people come from care, um, when we as therapists build a really warm attachment with them, potentially there's boundary issues. So warning, look at their attachment history and make sure that there are figures in their life that they are potentially attached to, and make sure you turn down your warmth dial, because I feel like they can, it's like lost duckling. When they find this perfect parent, they can, what's that word? The template? No, what do ducklings do?
The imprint, I think, right?
Imprint, that's the word. Yeah, they almost imprint. And I had two situations where, this is where clients fall in love with therapists, and they imprinted on me. And it's very hard to generalize their CRB2 connections with me outside to their partner. And this lady actually fell in love with me, and I am straight. And she's married, she's got a wife, but she just refused to work on generalization with her partner. In the end, I basically had to stop sessions because we're just not going anywhere. We're just having these conversations and then it's not working. So from hard-earned experience, I realized, okay, I really need to look at their attachment history first. And sometimes turning up the warmth is not helpful. So it's context. So this is where rule 4 is absolutely beautiful in FAP. Our awareness, and all the FAP training level 1 is really honing that therapist awareness, looking into ourselves. What are we bringing to the room? What are our ones that potentially can get triggered? And also, not just that, we bring so much, a whole wealth of experience, lived experience, and we can translate that wisdom into compassion and understanding for the client. So using our experience to really bring out the twos, and reinforce that as well. So what is that? It's basically noticing, am I always evoking a 2, and kind of checking, and basically what does that look like? You want to see a certain behavior increasing over time, right? As simple as that. Reinforcement theory, is it increasing? If it's not, then it's not working. And not just in session, outside, are they reporting they're doing more and more of certain things? And if they're not, you're going to basically come back to drawing board, get supervision, and make sure that you're not building a unique relationship with your client. So are you invoking, are you reinforcing the right twos? And also, are we blocking ones? So anything unhelpful coming into the room, can we redirect them into 2? So we keep, being a FAP therapist is like dog with a bone. I just keep evoking 2s. If it's not coming, I'm going to try it another way and another way. So, okay. Too many clicks. So on a micro level, what is the client's immediate response to your intervention? So we're looking at what just comes back, right? So when I asked Lewis to do that, and somebody picked up his nonverbal, yeah, I'm constantly watching the nonverbal. Is he pulling closer to his own experience and to me, or is he pulling away again? And in that instant, he pulled away. And the macro level, we're looking over time, treatment, course of treatment, the shape of treatment, has increased to over time. And of course, be aware of T1s. So this is technical language as well. T1 is when we end up either evoking the problem behavior, we bring it into the room. So if we come in and we're in a bad mood and we're grouchy, we don't notice where we are, and we match an aggressive client then immediately gets their heckles up and they become defensive. We basically evoked conflict, right, without realizing. So that's a T1. Or we end up reinforcing a problem behavior. So if a client just bring a lot of content, and we start to listen and get curious about their life and asking content questions, we're basically evoking T1s if it's not helpful to what's the behavior change in the room. We start gossiping with them maybe. And T2 is always bringing the behavior into the room and reinforcing the helpful behavior. So we stay on task. So FAP level 1 is all about developing ourselves as instrument of change, because that's really where the FAP rest on is. And it's really important to never, never lie to ourselves. Don't lie to others, but least of all to ourselves, right? And the thing with FAP, and I point out more, is when we start to do it, we actually feel quite powerful because we're using behavioral change processes. And so hubris and ego can often grow. So now ask yourself these questions. How often do you check if the client is responding to you, right? Can we just pull back and check? And what do we tend to avoid addressing with our clients? Who talks more, you or the client? And, people a more directive approach. If you're talking too much, then maybe that's not helpful. You're not doing. How do your avoidances impact the work that you do with your clients? And what are specific T2s you want to develop? Right. So T2s, you kind of have to face your T1s to know where you need to grow. So these are kind of really kind of hard questions we need to ask ourselves. And yeah, if you want to share maybe some answers to some of these, welcome to put it into the chat, because I know you'll get the chat afterwards. It's kind of nice to know that we're all in the same boat. So over time, as a FAP therapist, I noticed that I am less and less avoidant. I can talk about pretty much anything, I think, which is slightly sad because nothing is sacred anymore. But I guess that's what being therapist is about. We have to face all human conditions. So, and also the important thing is we exist in the room. Can we ask ourselves, are we reinforced by our clients' improvement successes? Because if we're not, this is burnout territory, right? And sometimes we get really frustrated. We go for the big goals, are their depression scores down? Are they changing their life wholesale? Doesn't always happen. Sometimes all we can do is plant seeds. Are we skilled enough to notice the little saplings coming up and be reinforced by that? So we have to really learn our awareness. Rule 1, to tune into nuances. What are the baseline and what's shifting in tiny, tiny incremental ways, and get good at noticing that. Do we know enough about our clients to detect small improvements? And can we relate deeply to detect when they're improving? So all of this rely on our relationship with them, right? It's like your partner so well inside out, and what gets them and what makes them happy. Can we offer that to our clients and be willing to take risks when needed in the service of detecting and reinforcing improvements, to say, can you do this with me now? Right? Can you share this moment with me now? And that's taking a risk. And if they can't say something, it's like, even just an expression of closeness. If they're on the cool side, we have to model that. I feel like over the last few sessions, I've got to know you really well, and I like you more and more, even when you're being cynical. I like that cynicism. I like the dry humor, right? And I really appreciate that. Has anybody ever told you that? Right? And would you like to know? Could you ask your partner how you impact them, to be able to really bring that behavior into the room? And can you care enough to do all of the above, right? Sometimes do we just go in the room, chuck intervention at them and just walk out? But being a FAP therapist, occupational warning, it is intense. It involves emotional investment, right? And when we go into a FAP intensive, the biggest thing that we come out with is, oh my gosh, I just received so much love and care from everybody. And it really highlights what's lacking in our lives. And it's broken up a few relationships going to a FAP intensive. So we as therapists have to really look at our quality of life, who's reinforcing us outside, so we have enough emotional energy to offer our clients. Because I know end of the session, end of the day doing this work, I am worn out. I can't talk to my kids. My kids know when to leave me alone, which is my biggest regret and biggest sadness. Because I can't be there. I don't have emotional energy for them. So I need to make sure that I am getting enough self-care to replenish that. And yeah, so learning to tune into their improvements is really important for our job satisfaction. And finally, rule 5, at the end of the session, what have you got out of this? What's helpful? What's useful? What can you take away? So maybe can I ask you that question? If we pause here, maybe if you let the last hour and a half or so sink in, has there anything been impactful? Maybe the information, maybe some of the questions I've asked you to consider. And can you just describe in the chat what stood out to you and what you think you would want to take out from this training today? I'm liking some of the chats. I'm missing out all the dialogue going on there. It's fun. And yeah, block is extinction. Yeah. In terms of FAP interventions, yes, it is like 70s, like anything goes, right? As long as we stay true to the theoretical process of functional analysis, any intervention goes. And it is fun.
Then there's a couple answers to the question, Tien. Do you want me to read them?
Yeah, go for it.
Okay, so Chris says, becoming more attuned to my state over the course of an hour session, how one session may impact the next if I don't reset. Lewis says, contact with FAP always leaves me yearning to be a little more courageous, more willing to show, and therefore own my own responding to the client, among other things.
Yeah.
And then Christina says, affirmation that continuing to decolonize my therapeutic approach and style is in fact supported by science. Therapy is a way to safely practice being in relationship, but not a substitute for them.
Yeah. Oh, so it's really helpful to know that. And absolutely, I think really pay attention to context, who's in front of you, and really understanding that. And at the end of the day, FAP is just functional analysis. And when we learn to do a really good functional analysis, and then anything goes, intervention can be eclectic, but functional analysis has to be true to its, you have to have its fidelity. So a quick reminder, awareness, courage, love is the colloquial language that hopefully brings out the functional class of behavior that you're aiming for in session. Therapist impact, our own awareness, and at the end of the session, always get feedback and what's being useful, what can you take out from the session, how can you apply it, and that is kind of the session structure. I never end a session without the interpret and generalize piece, because it has to generalize outside to stay safe and to run an ethical, safe treatment. So that's kind of the efficacy research you'll get in the handout. Some of you, oh, this is important. So there's ethical considerations, because FAP is an emotionally intense and quite a powerful approach. Basically, you're learning to manipulate for good, right? This is, people shy away from that word, but we are. Because we're trying to bring out behaviors and influence behaviors. And so with ACT or third wave, we're influencing and predicting and influencing behavior. So we need to consider what we're getting into when we're cultivating intense therapeutic relationships, especially we're using warmth and attachment as natural reinforcers. Be humble. I'm getting very fed up with meeting people who are not. FAP is difficult to do well, really is. So don't feel like, you have to know it. It takes time. It took me, this is 15 years of work to get here. we have to update our client therapist case conceptualization regularly, right? Because things can come up, things change, and it's constantly evolving. Behavior is constantly evolving. Look at any client target behavior in your own repertoire. So what does that mean? Whatever you want the client to do, can you do it? Can we walk the talk? Right? If you can't do it, then that has to be something you bring up in your supervision, because if you can't do it, then it's your T1. Can you grow yourself to do it? So you can model it, you can feel the pain of learning to do it, because if you understand that pain, you generate compassion for your clients, right? So really using our lived experience as a skill. It is a powerful approach. So watch for hubris and manipulation. Unfortunately, being on the ethic committee, we bump into cases where, yeah, let's say trainers getting a little bit too above themselves. So when you start to do it well, hubris and carelessness can happen, and we start to cross boundaries. So be careful of boundary crossing. Continuously orient towards the client's well-being. We're doing this to serve them, and CRB2 is their target behavior, not ours. Okay, be controlled by reinforcers that are beneficial to them, not our own values, not our own expectations. And their environment has to be able to reinforce their behavior, not just us, because it makes us special. We can reinforce, but it's not going to do them any good, right? So do they have people out there? And oh yeah, there's a thing about touch, but that's a whole other thing. uh, we can't do it alone. So this is why I think building a FAP community is really important. It's a bit like a DBT. If you come from a DBT background, it's intense, it's fast and furious, it's draining. So having a community of therapists around you to be able to talk shit and just banter and just vent is helpful. It's okay. You know, we don't mean it, but sometimes we just need to let out steam, and that's okay. And watch for burnout. Like I said, FAP makes you into a high maintenance partner, believe me. One failed marriage. So it's important that you make sure that you get the emotional energy topped up regularly by people around you. And part of that risk taking is to be able to ask for what you need and to be able to build a relationship that works for you. So we need lots of hard self-care sometimes, not just the easy bubble bath stuff, but the hard stuff to be able to ask people. And we need colleagues in the work with us, right? So don't isolate yourself. So yeah, that's it. So I'm leaving some time for Q&A. We do have a FAP intensive in Budapest in May, end of May. If you want to join and play around with us, you'll get exposure to sort of a more developed later FAP theories. It's designed for beginners all the way to advanced FAP trainers. And is constructed in sort of a very transformative way as well, because you basically transform as you learn. So if you're interested, QR code is there. If you have any questions or curious about anything, email's there. And that's basically it. Yeah. Should we go back to questions?
Yeah, let's go back to questions. Just want to take a moment and thank you for what a like fabulous, insightful presentation. I was like looking at people and everyone's sort of like on the same page, just nodding their heads the whole time. And Lewis as well. Thank you so much for being brave and showing up. That took a lot of courage, and that was like incredibly beautiful and powerful to watch. I'll speak for myself, but imagine other people feel the same way, I'll guess. So thank you all for this. But yeah, let's do questions. Tien, how do you want to do it? Do you want to have people put in the chat? Do you want people just kind of like shout out? What's the best way?
Could do a mixture, and if there's absolutely no question, I can literally do a 5-minute demo as well, so you can see the whole process being panned out. Which, yeah, so you guys can decide what's helpful.
Yeah, so yeah, if you have questions or if you want like, want the demo, maybe just type in demo, and we can see.
All right, so I can only see demo need a volunteer. um Who's the other person? Is it you, Michelle? Did you put your hand up before?
Yeah, I think it was Michelle.
Oh,
You
okay.
feel free to back. She's like, oh, after seeing that, I'm not
No, no,
gonna.
no, I'll do it. I'm like, I'll volunteer. Really quickly, I think before we get to that, Talene had a really good question earlier, like way up there. I think would be helpful because I'm also DBT trained and I know there's a lot of orientation with that. She was asking about and maybe Talene wants to speak to it, but do you ask for permission before you evoke emotions? How much orientation is there? Maybe I think for people who don't know about FAP, that might be helpful also just to answer before we get into the demo.
Really fabulous question. Yeah, because you're basically not doing a proper FAP training. Yes, we have this thing called a FAP rap. Terrible. And basically that's to socialize and orient the client to the approach that we're doing. So it's pretty much, if you're my client, Michelle, what I am is I'm a behavioral therapist and I follow this approach called functional analytic psychotherapy. But basically what it looks like is I work with our relationship in the room. So whatever happens in the room is a bit like a little laboratory. Sometimes your problem behavior will show up here. And what I do is I kind of become your mirror. I help you to see the things that you do that might not work so well for you. And then we try to work out, can we change that in a way that will just work better outside? Right. So I become your guinea pig. Maybe we can practice doing some of these changes here, and then I'll support you to change that behavior outside. So that's the kind of approach that we use. But I rely on our relationship together to help, bring out some of these behaviors. And it can feel uh, very intense sometimes. That's part of bringing out a real situation between us. So that kind of makes sense. So we kind of socialize. So otherwise, yeah, if you start changing your approach and bringing this kind of emotional intensity into this room, it does freak clients out. So great question. So we basically in the training we ask therapists to practice their FAP rap, and they do it a few times until they get get it fluent. Okay, so sorry, I got distracted by the chat. I guess as a theme, we normally just set you a theme. So your best self. So Michelle, can you tell me how, if I ask you, what is your best self, what comes up for you?
My best self is open, grounded, curious, interested in present moment, and also appreciating my experiences and also opening up to, like I said, whatever comes next, with as much grace as possible.
And I guess, looking at your day just started, I think. Has anything happened already that maybe pull you away from this best self?
I do think my day started very early this morning. And so there were some things that I noticed the tug or to pull away, or maybe emotion coming in where I could have gotten lost in a different direction, easily if I wasn't aware in that moment. So I kind of had to reorient to the way I want to live, my values, and how I want to live.
Yeah. And I kind of see you showing up now and being present with me, even though you woke up really, really early, and I can relate to that. I woke up before 6 as well. And yeah, it is hard to stay present when we're sort of feeling tired and slightly disconnected. And you already have a day ahead of you to consider. Does that pull you away?
Yeah, I think I have to I tend to get into the present moment so much sometimes that I have to then look ahead to see what else do I have. And so balancing where I'm going next and where I am now is generally a fun juggle for me.
And as you're with me right now, what do you think I am seeing you? Are there aspects of this best self that is showing up between us?
I don't know. I'm curious about that because try not to make assumptions, so I can't tell unless you express it to me. From what I notice with you, it seems like you are noticing that that can be hard at times, and so that feels nice to have compassion. So there's that compassionate part of me also that feels that from you. That's registering for me, but I'm not sure. I'm curious to hear from you what you might think
Okay.
showing up as my best self.
I noticed when I ask you that question, is your best self showing up? Um, you almost asked that back at me. Am I seeing your best self?
Oh, yeah, I thought that's what you asked me. Sorry. I misunderstood that.
It's okay, but
Sorry.
you said you're curious, and the fact that you able to be so open and honest with me,
Yeah.
it, that sounds like a version of your best self.
Yes.
Certainly curiosity and kind of wanted me to kind of to tell you, well, what am I seeing?
Yes. Yes. I think because that's me living my best self. And so curiosity is natural for me. And I think one thing that keeps me in curiosity is to not try to make assumptions about what someone else might be experiencing of me, because as we talked about, the function and so forth, I just um, don't want to read into something that is not there.
Mhm. Okay. So is there anything that you would need maybe from me that can help you show more of that side of you or show more of you?
I think just like you did right there, just asking in the moment, maybe what now could I do to support you in encouraging more of you coming out, or maybe practicing behaviors if I need to. For example, if you notice me going into an emotional state, to try to also be curious about that and just stay very present. I think that helps guide me through whatever comes. That's my highest desire in life. So I would very much appreciate that.
Yeah, I hear that, and I also notice that um, you it's really important for me to see you in that being you. That is something that's really important and kind of I guess reinforcing for you.
I think so. I think so. I think that's also what I see in others. When I see it in myself, I'm more able to see it in others. So it's adaptive for me in a lot of ways. And also, then we can dive into things that might be more difficult to move me into other areas that might not feel as comfortable, or if I need more of that psychological flexibility to show up differently at different times. I think as long as we can see this part of me, my best self, then we can also look at some of those other behaviors that might be more challenging.
Okay. So, very well time. And so I let's go to analyze generalized questions. So, um, just tracking it through, we kind of evoked your best self, and I really feel like you also give me that space to just be comfortable with you, and like you said, there's the safety. You kind of created safety in the room between us by saying, "Okay, this is me. I'm curious. I'm also curious in your experience, in my experience, and I really appreciate that." And what would it look like if you can take this out into a situation where it's hard to show up?
I think that it would mean a lot to me, and it means a lot to me when and if I can take that out into the world. So I'm thinking about with clients today, I have a full day. I go into the evening, I'm going to a fundraiser tonight. And I think, the difficulty is contextually, people are hoping for something of me that might look different. And so, how can I bring some of this with that? So it doesn't have to be either or, maybe it can be together with clients and, just to keep the consistency throughout, feeling like this part of me is really present. I think that will be hard sometimes because everyone has their own version or expectation of what they might be looking for. But still, I feel confident that I can, I hope, stay in this. So it's nice to be with you now to help reinforce that for me to continue.
Yeah, I really see your constancy here.
Mm-hmm.
I feel like you've been really constant with me in this whole dialogue, and there's a clarity in how you talk about yourself. And even though it's this demonstration, I feel like, oh, okay, it's, this is somebody who knows and really connected with who you want to be and who you need to be. So just take a moment to maybe connect to that part of you. Thank you so much, Michelle, for just helping us kind of see the logical FAP steps. So I suppose when people come and watch a FAP interaction, it's like it just sounds like a conversation. And it is like that. It's actually a very smooth conversation. There's nothing technical. Like notice, like I tend to ask questions because Socratic questioning and is the best way of directing attention. So I want to direct your attention to certain things. So yeah, it's like the mechanism is under the hood, but on the top, it just feels like a very human conversation. Thank you, guys. Oh,
Thank you.
I don't know, Max, over to you. I've
All
used up
right.
my time.
Yeah, I think we are good. I'm gonna go ahead and end the recording, and everyone who's still here, check out Tien's Intensive if you want more of this. I think it'd be pretty sweet. And yeah, this is incredible. Thank you so much, Tien. You really, yeah, this is like I think just what people came here for. So really appreciate your time and expertise.
Thank you, Max, and thank you all of you for having me. And if you're interested, just yeah, pop in. There's level 1s and level 2s going on all the time. Keep an eye out for that. Take
Yeah.
care.
Thank you, Tien. Good to see you.
Bye, guys. Bye.